Please welcome Dr. Marjorie Dixon. We're talking about staying healthy, but we're going to focus this more on visiting the doctor because some of us really like visiting our doctor a lot. Hello,
I don't know who that would be.
I just think, you know, if anything's gone wrong, my father always taught me. I know.
Did they tell you why you're here?
Yes, I feel like over the years it's been like, hey, could you come back less frequently? So we need to talk about, you know, how often you should be visiting your doctor and when you should actually go, because there is this misconception of the routine checkup.
Yeah, so traditionally it was that you went to your doctor once a year and you got blood tests done and you did whatever they said you needed to do and you felt good about yourself because they'd either give you a stamp of approval or give you a little bit of a speech about the things that you needed to change.
Right.
Well, having that annual visit, if you're a young and healthy person, if you have no chronic illnesses or diseases like diabetes, hypertension, high cholesterol, that you're at a healthful weight and you don't have any really bad habits, you don't really need an annual visit.
But don't you just go there for them to tell you you have hypertension or diabetes or any of the above? Like, isn't that why you're going? Just so they can warn you?
They actually looked at studies objectively. So this is why we have medical literature to guide us, to help us to decide. So across Canada, in the different jurisdictions, there was actually kind of an overhaul of the annual physical examination and the purpose of it and whether or not it should be like that kind of a visit. You need screening tests. We have screens for cervical cancer. I've always talked about those things. You need to stay healthful. You need to exercise. You need to minimize your risk of cardiovascular disease, one of the biggest killers of women. We know that breast cancer is an issue. You need to be screened for breast cancer. But not every individual needs to be screened annually for all of those things.
Okay.
So now there is a different kind of tailored approach to medicine. So if you know that you have a family history of breast cancer and a first-degree relative that's a woman, then you need to be screened early on. And your doctor will tell you how often you need to go. It's not that mammograms need to start for everybody at age 40 anymore. And cervical cancer, those screening recommendations have also changed because now we realize that even though, yes, it is a precursor of cervical cancer to have a pap test that looks abnormal, it doesn't necessarily mean if you have 3 normal pap smears in a row and you have the same sexual partner and you've had no abnormal pap smears before, you only need one every 3 years now.
It's one every 3 years.
One every 3 years. So all of the intervals for the different things are changing. So it's important to be informed about what it is that you need to screen for at different ages. We've talked about vaccination at different ages. We've talked about different blood tests that need to get done. If you're screening for your fertility, which should be done in your late 20s to early 30s, not wait until you're 40. Like those things, it's important for women to empower ourselves and be educated about. But you have a responsibility as a patient as well.
So who needs to go in then for annual visits?
If you have a chronic illness like hypertension, diabetes, high cholesterol, something that requires adjusting of medication on a regular basis, sometimes thyroid disease, those types of chronic illnesses, then yes, you do require an annual visit. And your physician will also communicate with you that based on your family history, like there are some people, colon cancer screening doesn't really start until you're 50, unless you have a family history of colon cancer, in which case you need to have screens and colonoscopies more frequently at an earlier age. So based on your family history and based on your age group and based on you. So what can you do to keep yourself in that low risk category so you don't have to visit the doctor unless you're ill?
Okay, so let's go through the list of things you do need to do to make sure that you do not have any of these things. What's your responsibility to yourself and to your own body?
So the top 3 things, and actually Cityline does a really good job of helping keep you, Tracy, healthy because you're very mindful of what we as women need to keep ourselves in a healthy category. The number 1 thing that you can do for your healthfulness would be what, do you think?
I would say stress relief.
That's a good one. So that's in the top 5.
Stress is a big one. I would say exercise and eat right.
Exercise, healthful lifestyle. So that means that you want to be an active person and you want to be cognizant of your body mass index. Often people say BMI. What's BMI? Body mass index, you need to have a calculation of your height and your weight, and you can go online and you go to a BMI calculator and you can see where you're at. For healthfulness, you want to be between 18.5 to 25.
Yeah, make sure you're in a good mood before you go to that calculator.
But it's purposeful because BMI is an objective tool that we can then use to say your risk. So women, we tend to, after age 18, gain weight, and then after menopause, that extra 15. There's a freshman 15, and then the menopause 15. It is what it is. So, but we have to battle that, because we know that when you do gain, women who gain between the ages of 25 and 50, 30 pounds or greater are at greater risk of breast cancer.
Between 25 and what?
50?
More than 30 pounds?
Yeah, greater risk of breast cancer.
Because that's like one
So,
pregnancy right there.
I know, and so that's
Right?
why we encourage people to
Yeah.
exercise and stay healthful.
Right.
The other one thing, so be it a good body weight, it also helps you for a host of other things. It decreases your risk of heart disease, of hypertension, high cholesterol. So it helps you to stay away from the doctor. It's not an apple a day, it's exercise a day.
One
And eat
point I will
healthfully.
say before we close is that if you do feel that something is wrong,
Absolutely.
you be your own advocate and you
Yes.
go in and you see that doctor, you see that physician, you say, I do need these screenings, I do need these tests.
Exactly.
So fight if you're feeling not right.
If something is not right, you know yourself the best. That is
Yeah.
true. I'm not saying to discount any of that.
Yeah.
And actually, that might be more useful
Right.
than necessarily just going to the doctor and saying, I know that I've been really helpful, but I have a feeling, so can I just have a full body scan?
That's me.
It doesn't work. I know, right?
Knock, 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 everything. Give me every test. All
So-
right, thank you so much
Yes,
for
and
the
quit
advice.
smoking. Don't smoke. It's bad, 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 bad.
Yeah, and every
That's
doctor will
another
tell
good
you that.
thing. Yeah.
Stop smoking immediately.
Yeah.
Let's go to break. We have more coming up. Yeah.